So Sean Corning is with us today. They are an education and outreach coordinator for the network of the National Library of Medicine Region 7, which is located in the Lamar Suter Library at the University of Massachusetts Chan Medical School. In their work with the network, they focus on academic libraries, substance use disorders, information literacy, and research data management. So thank you very much for coming today, Sean. Take it away.
Hey, thank you so much for that introduction, Claire, and thank all of you for coming to this presentation. Today, I'm going to be talking about the connection between health literacy and health communication. So I just want to start off by giving a little bit of background on the network of the National Library of Medicine, which is usually known as the NNLM, for those who are less familiar with it. The network of the National Library of Medicine is funded by the National Library of Medicine, which is the world's largest biomedical library. The NNLM serves as the outreach and education arm of the NLM. And then the NLM is part of the National Institutes of Health, which is the nation's leading research agency. The NNLM is made up of ROCs, which are regions, offices, and centers. There are 7 regional medical libraries, of which I work for NLM Region 7, which covers the states of Connecticut, Massachusetts, Maine, New Hampshire, New York, Rhode Island, and Vermont. So as part of the NNLM, what we do is we for our region, we do outreach, we do education, which includes providing webinars such as this. We do national trainings. And if you'd like to learn more about the NNLM, you can check out our website at Untitled.Chapter. The Region 7 also puts out a regular newsletter that highlights programming and training opportunities from across the network. It's a great way to keep up with what we're doing. I'm going to drop a link to subscribe in the chat. Oh, doesn't look like oh, there we go. Sorry. Couple pasting issues. One thing that we do is every year we offer a number of grants around things, a lot of health outreach and technology support. That's something that will be, when those calls for funding are available, that will be announced through our newsletter. So if you're interested in that, you can subscribe to that. So to move on to the workshop today, after this session, you'll be able to define health literacy, describe universal precautions for health literacy, name 3 components of clear health communication that contribute to health literacy, and identify 3 online resources that you can use as tools to improve health literacy. So we're going to start with an introduction to health literacy, going to cover what it is, why it's important, and some risk factors for low health literacy in the United States. Next, we're going to discuss on how clear communication plays a part in health literacy. We'll go over some best practices for written communication to improve health literacy, including the use of universal precautions, plain language, and tips for using visuals and graphics. We'll largely be focusing on written as opposed to oral communication. I'm going to show a number of tools that can be used to implement what we discuss, including the AHRQ Universal Precautions Toolkit, Plainlanguage.gov, and Medline Plus. Throughout the presentation, I'm going to be mentioning a variety of resources and sources. You can find links to this information in our session handout, which I'm going to paste here. It'll download as a PDF if you click on that link. So what is health literacy? The definition of health literacy includes 2 primary components, personal health literacy and organizational health literacy. It's a relatively new definition and especially the incorporation of organizational health literacy is a relatively novel addition. So personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And then organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves, for others. One of the really important additions is the focus on equity. These is a call to reduce health literacy disparities. So this new definition came out of the Healthy People 2030 initiative, which is a national initiative with the goal to eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. So it's important to recognize that health literacy is a shared responsibility. The current definition with its two parts make it clear that health literacy is a responsibility shared between individuals and organizations, and between anyone who provides health information and anyone who receives information. This new definition is also a very action-oriented one. It's about enabling individuals to make better decisions about health. So health literacy impacts health-related activities in many different contexts, some of which you might consider routine. Thinking of an individual trying to make sense of conflicting nutrition advice, a worker reading safety precautions, a new home resident considering lead testing and what a lead testing result might mean for them and the health of their family, or someone deciding about health screening options. Understanding medication labels and instructions is another example of activity commonly impacted by health literacy. Medication errors are very common and are more likely with people in limited health literacy skills and can have a substantial negative impact on people's health. So thinking about this, does anyone have, think of a time, and you can put an answer of this in the chat, of when you were impacted, or you or somebody that you know was impacted by limited health literacy, a time when you had to make a health decision and the information you had hard to find or understand or use. I'm just going to give a little bit of time for you to think about it. And I'll read off answers that folks put in the chat. Yeah, Claire, that's a really good one. Yeah, is when there's people are getting information from unreliable sources like Facebook. Yet when information and trusted sources don't agree, just because journal articles are not, there's not a coherent person who's deciding, okay, all of this all agrees. It's just, has to pass basic peer review, and then it's up to the information, you as the health information consumer to then be able to evaluate and judge that information. And that really heavily relies on health literacy skills. So there's some good examples. So a thing important to think about health literacy, as I mentioned before, it's an action-oriented concept. It's about finding, understanding, and using health information to make decisions. It's not just about being able to kind of sit down and read a journal article and be able to understand it, or be able to look up what a medication is and then be able to find a reliable health information and be able to kind of understand what you're reading. It's about being able to make decisions and then put that into use. And this can accompany a lot of different skills. At the individual level, it can cover reading comprehension, reasoning, and numeracy skills. At the organizational level, health literacy encompasses making communication materials such as medication labels, health education documents, signage, clear and easy to understand. It also includes, and this is something that's a little bit more relevant to librarians, as selecting already existing health communication materials that will be promoting good health literacy and clear communication. And it's more than just an intellectual capacity. It's an action-oriented concept and proficiency in health literacy helps people make informed choices about health, which then improves health outcomes. Kind of in the time of COVID, as kind of Claire used in her example, health literacy is in many ways as important or more important than ever. There's a lot of information out there, and we regularly face health-related decisions. What kind of masks? What are the current recommendation given the current case numbers in your particular area? What different guidance means, where it should apply, how risky particular activities are. There are lots of graphs that are going around, statistics, which can be difficult to understand. And that's only thinking about kind of reliable information. And there's tons of misinformation circulating that requires people to do a lot of health information evaluation on their own. As a recent editorial put it, without good health literacy, people aren't able to effectively differentiate between facts and fiction and can allow unreliable information to influence their behaviors. But it's also the responsibility of information providers to provide clear and simple information that can be understood. Oh, I'm sorry, that is my fault. But it's also, the pandemic has also resulted in calls for critical health literacy, which includes helping people to grasp the reasons behind recommendations, critically assess the information available, and reflect on outcomes of their various possible actions. So why is health literacy important? The simple answer is that low health literacy leads to poor health outcomes. People with low health literacy are more likely to need to visit the emergency room, and they're more likely to have to return after being discharged from emergency room or hospital stay. This is likely because health literacy impacts one's ability to understand and then follow discharge instructions. People with low health literacy are more likely to have hospital stays and less likely to follow treatment plans. They're more likely to skip needed tests and underuse preventative healthcare even when it is available. Not surprisingly, these and other factors correlates with a number of adverse health outcomes, worse reported health status, lower quality of life, and ultimately higher mortality rates. But the good news is that health literacy is considered a modifiable risk factor. Through education and through better organizational health literacy, these factors can be improved. So there are many disparities in health literacy levels in the United States, and I'm going to go over some of the risk factors. This is pulled from some information from the Agency for Healthcare Research and Quality. One key risk factor is low income. Adults living below the poverty level have higher rates of low health literacy than adults living above the poverty level. This connects with other socioeconomic variables that are associated with lower health literacy, including being uninsured. Chronic illness and disability are risk factors, and particularly for disability, hearing, speech, visual, learning, mental, and emotional disabilities are connected. The National Adult Literacy Survey showed that a significant portion of people with these disabilities performed at the lowest NALS level of literacy. Later, we'll go over some plain language principles and resources that can help people whose disability impacts reading comprehension. Unfortunately, there's just not enough time to really go into depth on making communications more accessible for people with disabilities, but I've included some links in the resource lists that you can check out that gives some more information. Age is a significant risk factor. Adults over the age of 65 are more likely to have low health literacy than those under 65. Speaking English as a second language or as anything other than your first language is a risk factor within the United States, since health information is primarily and in many cases exclusively available in English. That makes it much harder to understand medication instructions or health education materials. Later, I'll highlight Medline, the way that you can use Medline Plus to find health information that's written for the public in languages other than English. And some of the greatest disparities in health literacy come under racial and ethnic minority groups. In addition to language, cultural differences impact communication and understanding. Belief systems, customs, historical trauma impact response to health information, which then impacts health literacy. Creating communication materials with cultural humility and awareness is another area that's essential to equity, but I also don't have time to go into fully today, but I've also included some links about that in the resource list. Low education is a risk factor, which ties into the connection between low print literacy and low health literacy. By print literacy, I'm talking about like reading, writing, and numeracy skills. However, having low or high print literacy isn't necessarily a one-to-one correlation with low health literacy. Someone can have a average or above average print literacy, but still have have low health literacy in particular contexts. And it's also important to remember that these are all factors that can intersect. They can layer and compound each other. And at the individual level, kind of education can mediate all of the other risk factors. And this is really focused on the individual health literacy. In particular instances, this is affected by the cultural language and the characteristics of the organization providing the health information and how they provide it. So this connects directly to kind of the next section that I'm going to talk about, which is health communication. So effective health communication is essential to health literacy at both the individual and the organizational level. If we're not being able to communicate with somebody well, then their ability to understand health information and thus their ability to put it into action, which is what we're defining as health literacy, will be diminished as well. So to be equitable, we must design health communication materials and select health communication materials that are accessible to everybody, with special attention to those who are at most risk. So there are many different domains of health communication, similar to how health literacy covers many different domains. This can involve constructing public health messages and campaigns, communication between a health professional and a patient, disseminating individual and population risk information, educating consumers or patrons about gaining access to public health and healthcare systems, individual exposure, search for and use of information, and also things like images of health in the mass media, which folks like us might have less of an impact on. So something that's really important when you're thinking about health literacy and health communication is that you can't tell by looking what the amount of health literacy that somebody has. We've talked about a bunch of different risk factors, but you can't go into an interaction or thinking about addressing a population and guessing at who has health literacy. So to get around that, one of the hallmarks of health literacy best practices is applying universal precautions. The idea behind universal precautions is to always be communicating in a way that as many people as possible, ideally everybody, can understand what you're communicating. Everybody is at risk of misunderstanding. According to some measures, only 10% of adults have the skills needed to use health information that's routinely available. Research shows that intervention designed for people with limited health literacies also benefits those with stronger health literacy. When information is clear and is easy to act on, people feel more involved in their healthcare and are more likely to follow through on their treatment plans or enact behaviors. So one really great resource is put out by the Agency for Healthcare Research and Quality, AHRQ, which publishes and continually updates a health literacy universal precautions toolkit. This toolkit provides evidence-based guidance for addressing health literacy by ensuring that systems are in place to promote better understanding. It contains 21 different tools that address things like spoken communication, written communication, self-management and empowerment, and supportive systems. For all of these tools, there's specific actions to take and guidance for tracking your progress. It's really intended to be a very practical tool to be used and put into practice rather than a more abstract theoretical publication. It's really useful information for anyone who wants to promote health literacy in their organization. And if after this talk, you're interested in learning more about how to put the concepts that I'm talking about into practice, this is a great place to start. And like the other resources that I'm talking about, it's linked in the handout that I linked earlier. So one way to help your communication and in general in your health information communication be more accessible is by using plain language. It's really essential to effective health communication. Plain language is a way of communicating that focuses on helping people understand something the first time they read it or hear it, and reducing the chances of misunderstanding or misinterpretation. So there's I've selected some guidelines for plain language. One is to write for your audience. And this is more than, and one of the kind of popular myths about kind of plain language or writing things that are easy to understand is that it means you have to dumb down your content, and that's really not true. What you want to do instead is to use language that your audience will understand and feel comfortable with. Don't write for an 8th grade class if your audience is, PhD candidates or small business owners or working parents. Only write for 8th graders if your audience is in fact an 8th grade class. So kind of try to meet your audience where they are. Organize your information to serve the reader's needs. Put your most important material first and organize in order of importance to audience. Start with a clear statement of your purpose and the takeaway that you want from this art, from whatever communication you're doing, and then include background or contextual information more towards the end. Chunking information is really helpful for comprehension by breaking your document into separate topics, using descriptive headings and subheadings liberally, keeping paragraphs short and really having each paragraph only cover one topic. Bullet points are also a really good way of chunking information and making it easier to comprehend. Be concise. Omit excess words. Don't use complex grammatical or syntactical structures. And also try to limit the information that you're providing to need to know information rather than nice to know information. This is something that when I'm writing, I fall into is I like kind of providing, tons of context, tons of background information, getting kind of into little digressions about things that I might find particularly interesting about a topic. But that can get away from what the receiver needs to know. So really focusing on kind of highlighting the important things that lead to the particular takeaway. When looking at the amount of items that people can remember, it usually limits to around 7 independent items that people can kind of remember at a time, and that can be lower for people with lower literacy skills. So trying to limit the items that you're talking about to 3 or 5 at the most. So if you're doing a list of kind of actions to take or information, keeping those shorter. Avoid jargon and use kind of familiar words that are used, and use words that are more common and more familiar instead of using jargon. And this is also something that's really contextual to whoever your audience is. And then some examples are instead of stomach or use stomach or belly instead of abdomen, skin infection instead of cellulitis. Try and using a conversational tone rather than a more formal, like academic style. Using you, the second person, when you're writing, especially if you're trying to convey some sort of instruction or something that is relevant to an individual. And especially when you're doing any sort of instructions, finding things that use the active voice versus the passive voice. Rather than saying it must be done, say you must do it. If we're, say you must wear a mask instead of masks must be worn, that sort of thing. So these guidelines are drawn from Plainlanguage.gov, which was put together by, I forget which agency put this together, but it's a government resource, and it was developed to really guide people to write so that people can find what they need, understand what they find, and use what they find to meet their needs, which maps closely onto what we're looking for with organizational health literacy. So the Plainlanguage.gov breaks down its guidelines, which go into much more detail than what I just talked about. It has broader guidelines as well as more specific guidelines. It has very concrete recommendations, like this example here about different commonly confused words or phrases and potential substitutions. It's a really comprehensive and useful tool that I often use when I'm writing for the public consumption, and I highly recommend it as kind of a reference tool. So we talked a little bit now about the principles of plain language, so I thought it would be useful to look at some real world examples. So this is a document about pertussis that was sourced from the Minnesota Department of Health. So this is an example of something that implements a lot of plain language guidelines. It's organized very logically. It states clearly at the beginning what the purpose of this document is, what parents need to know. So, and it's highlighting the audience. So if a parent is looking for information, they'll see this and they'll know that's what they're looking for. If they're not a parent, but they're looking for pertussis information, they'll be able to recognize quickly, maybe this information isn't the most relevant to me, so I might want to find something else. It kind of progresses logically from the purpose to what is a definition of what is pertussis, and then through different common questions about it. It really breaks things down into subheadings with only a small amount of very focused information under each subheading. It breaks things down. It breaks things to action items at the end into lists, into a very short list of 3 items that are in the active voice. So this is an example of kind of these sort of plain language guidelines that are implemented well. And then here's an example of a document that doesn't do it quite as well. As you can see, there's really no subheadings. They did use bullet points, which is good, but they have quite a lot of bullet points that aren't broken up by subheadings. When you have long lists like this, it's very easy for people to kind of gloss over the list and miss important items. And then also in their instructions, there are a lot of passive voice. Phrases like grills should never be placed indoors rather than don't place grills indoors, which would lead to more active compliance with these sorts of directions. So one of the plain language guidelines is to use familiar words instead of medical terminology. So people put into the chat some ideas of what you could use to replace these kind of medical terms if you were, speaking with a patron or wanted to communicate. So I'll go ahead and kind of talk through these examples. Yep. So yeah, that's a good one, Mary Carol. So instead of cardiologist, you would say heart doctor. Benign, you could say, yeah, non-cancerous or non-harmful. Anti-inflammatory, you could maybe just describe it instead of using a particular term. You'd say like this will reduce swelling, reduce pain. So these examples are pulled from Just Plain Clear Glossary, which is put together by United Health. Yeah, and I think Mary, that's something that's Mary Carol. I think important to think about is oftentimes jargon. It's very useful because you can compress a lot of information into a single term, which is very useful if you're a specialist and know what the terms mean. But if you're trying to replace them, you might have to use, a sentence to describe it instead of just going to a single word. And yeah, so I pulled these examples are pulled from the Just Plain glossary, which was put together by United Healthcare. It's not a government source, but it is a really useful glossary for these sorts of kind of medical jargon terms. So these are some examples of sentences that can be rewritten to make them in more of a follow the plain language guidelines a little bit more. So instead of your HIV test results were negative, you might want to say something like you don't have HIV or phrase it that way. If you look at the definition of negative, one of the definitions is not desirable or optimistic. And this is actually something that I've seen people kind of talking about in the context of like COVID tests, where the test might be saying it is negative on the list, but people might read that as the test result was bad result, a negative result. And so they might think that they are actually, have HIV or COVID or whatever the test is for. So you could say something like you don't have HIV or the test says you don't have it, that sort of thing. To kind of avoid confusion, trying to use not use words that have kind of multiple definitions that could cause misunderstandings. And then instead of a phrasing like take this medication on an empty stomach could cause some confusion because empty stomach is a little bit vague. What does that actually mean if you're not familiar with the phrase empty stomach? And what does on a stomach mean? Does it mean kind of like putting it on your stomach and what does empty mean? Is it empty of food? Is it empty of drink? What does that mean? So you could say something like, don't eat or drink before taking the medication. So you're kind of clearly saying the action that you want to be taken. It makes it more clear exactly what you mean, rather than being a little bit more idiomatic in your language. So a final example sentence is something like reduce sodium intake. So what would be a way that you could rephrase that to be in a more plain language, follow the plain language guidelines a little bit better? You can put your things in the chat if you would like. So an example there that you could kind of rephrase it would be to say something like eat less salty foods. Something like sodium intake, people might not understand kind of what that jargon is. And if you're really focusing on diet, you would want to say kind of have a word that's connected to diet rather than something like intake, which is a little more jargony, a little bit less clear exactly what you're referring to. Yeah, so Mary Carol, I think this would come into play if patrons are needing help understanding instructions, or if you're kind of I think a lot of times this happens if you're selecting between different information sources to kind of direct people towards. So if you're kind of looking for information on some condition where you might be finding, resources that are a little more jargon heavy that aren't following these guidelines versus resources that are using these guidelines. And also, even though we are librarians who are who aren't, providing information but not advice, some stuff that I'm going to talk about later is especially in the context of COVID, that you're often still, posting, things that follow kind of health guidelines for being in the library space, and making sure that those are clearly communicated is also very important. So I think it helps in kind of selection of health information, as well as the times when the libraries do have to provide kind of health information or health guidance, especially for within the library space. So something between is an important kind of distinction, which is a little bit nuanced, is the difference between plain language and readability. So readability is purely kind of how easy or not something is to read, and oftentimes is measured with readability formulas that kind of assess the grade level of a document. These are often built into things like Microsoft Word has tools where you can look at a few different readability formulas that will kick out grade levels or other sorts of readability scores. However, these can be very limited tools. They're all based on kind of sentence and word length rather than and ignore other factors that contribute to ease of comprehension. So because as an example, some jargon can be short words, but will not be accessible to a general audience that is not familiar with that jargon. But it might still kick back as a relatively low readability, low grade level. So you can kind of be a little bit misled if you're just looking at grade level scores about whether or not your materials are clear and effective, because they don't really take into the amount of context and other factors that plain language does, which really focuses on writing so that readers can grasp the message at the first time that they read it, as well as minimize potential miscommunications or misunderstandings. So a little bit about kind of visual to aid communications. They can really be an effective way to convey information because they fill in where words might not be understood or provide additional context. They can help people who have limited literacy skills to find, understand, and use health information, and can also often be grasped a little bit kind of more at a glance rather than somebody having to sit down and read through something. They shouldn't necessarily be used in the place of text because people can interpret visuals just as they do words in different ways, but are rather best used as to enhance text and to reinforce instructions. So a few tips: make sure that your images convey your main message, especially if you're trying to create some sort of action. Think about images that will connect to that action or show that action in progress or being done. Try to have images where the meaning's as clear as possible and as little use for understanding or a little potential for understanding. Supplement with headings, labels, and captions. You want to be clear about what the image is there for. So for this example, if the image on the slide was out of context, it would be a little bit kind of baffling as to what was trying to be communicated. There's a smaller person inside of a larger person. What's going on, as opposed to in kind of with the written message, it kind of is clear about the connection between the mother drinking alcohol and then it being passed the fetus also being affected by the alcohol that's being consumed. The message clarifies the visual, and then the visual provides reinforcement to the message. Use simple pictures. Research has shown that when illustrating a concept, simple line drawings are often the most effective, as opposed to kind of maybe a more realistic, intricate drawing that might contain more information, but might be less effective at getting the core point across. And also keep in mind that there's there can be variation in interpretation of images. There can be differences in the symbolism behind different images in different cultures or contexts. That can be, if you're working with a particular cultural population, being aware of what symbols might mean to them. That also can be age related. There can be things that might be meaningful to an older audience that a younger audience might not comprehend, or vice versa. Just as kind of an example of a visual that employs these concepts pretty well as it does the important thing of using examples that reflect your audience. It represents people of different ethnicities, ages, and genders, so that people will feel more included and that the guidance is aimed and directed at them and includes them. Reflects them. So this is an example of a type of a signage that could be improved. It might be a little bit confusing or misinterpreted. If you're looking at this and you're not looking at the text, if like maybe English isn't your first language, or you're kind of, far away, you just can't quite see the text. This might make it look like it's okay to be in a group eating and drinking. Whereas the actual message is to avoid eating indoors. So kind of adding things like an X over it or a slash through it to make it very clear that this is something you don't want happening. So kind of really emphasizing the clarity. Another factor this is a little bit on the accessibility side, is that oftentimes like do or don't and is indicated by red and green, green for do, red for don't. But red-green color blindness is a very common type of color blindness. So if the only indication between doing something or not doing something is red and green, that can be cause a lot of confusion for folks who are colorblind. So try to make sure that that whatever you're doing doesn't just rely on color differences, which can be hard for some people to distinguish. So I'm going to move into a little bit about Medline Plus. Some of you might be familiar with Medline Plus. It's the NLM's main site for consumer health. It can be used to learn about diseases, treatments, lab and diagnostic tests, and drugs and supplements. It doesn't contain any advertising, and it doesn't endorse any company or product. It can be really useful for improving health literacy because it's authoritative. It draws on government and trusted and then other trusted often nonprofit organizations. And it's really designed to be easily understood by a general audience. The topic summaries are written to adhere to plain language principles, and the content is aimed to be written at the 6th to 8th grade level. So this is an example of what kind of a topic summary page looks like. It also works as a good example of what plain language communication can look like. There's descriptive subheadings, short paragraphs, few bullet points. It's organized logically with the most important information at the top, and then as you go further down, it gets a little bit more detailed, and can move into more specifics. So another really useful thing about Medline Plus is that it has a mirror site in Spanish. Kind of where you can click on that is circled on the screen. And then this is an example where it's the same page we just saw, adhering to the same plain language principles, but in Spanish. And for Spanish, there's a full mirror site that is in Spanish. So you can go to the home page, it'll be in Spanish. You can search, the results will all be in Spanish. So it's a really great resource for folks who are more comfortable reading in Spanish. But beyond English and Spanish, a little bit out. So additionally, Medline Plus is a subset of particularly easy to read materials. This contains materials that are written to the 3rd to 5th grade level. It's going to be on the bottom left link of the main page. And there's also an easy to read collection in Spanish. If you're looking to provide health information materials to patrons with low print literacy or low education levels, this is a great place to look to see if it has information on whatever particular health topic they are looking for information in. Medline Plus also contains health information in multiple language beyond just English and Spanish. While English and Spanish are the only languages that there's the full site developed for, if you click on the health information in multiple languages section, that allows you to kind of filter by a wide variety of languages. Medline Plus also, it has a lot of kind of handouts and one-page documents that are intended for a general audience. So this is a document that I got from the Health Information in Multiple Languages collection, which is an instruction sheet on how to take TB medicine, and it's in Cape Verdean Creole. So note kind of the clear use of visuals that are connected with the text. And then another example of a health information resource. This is a one-page flyer or handout that could be used. It's in Chinese, and it explains mRNA vaccines. So by addressing barriers to health literacy faced by those who are most at risk, such as providing information in the reader's native language, we can more equitably enable people to find, understand, and use this information to make health-related decisions for themselves or others. So in summary, health literacy includes both personal health literacy and organizational health literacy. Universal precautions for health literacy ensure that we communicate in ways that everyone can understand. Using plain language or selecting publications and resources that use plain language communicates to effective and clear health communication. Using appropriate visuals and graphics can help clarify message. And there's a number of resources that you can use to kind of learn more about health literacy and improve your health communications. So here's my contact information. Please feel free to reach out if you have any questions, and I'll take some questions here. The link there, which I can will direct you to the About page for Region 7, which links to our newsletter, our social media accounts, and gives a little bit more information about kind of the types of programming that we do, if you're interested at all. And yet, are there any questions that I can answer for folks?
We are a quiet group today, Sean.
Yeah. Okay. It's a kind of dreary Tuesday up where I am. I'm not sure how it is down in New York.
Improving a little bit. It's
Yeah.
been raining, it's cloudy, but it's not raining now, so that's all good.
Okay. Well, yeah, thank you all so much for having me. It was great to talk to you.
Well, thank you so much for joining us. And is this going to be available as a recording, or what did Claire's nodding? Yes.
Yeah. So it was recorded. What was I going to say? Oh, one thing I meant to mention is if you're interested in learning more about health literacy, NNLM does offer an on-demand health literacy course, which can be found at nlm.gov/training, which you can sign up for, take on your own pace, and learn a lot more kind of details that I wasn't able to go into kind of in the limited time that I had today.
I'm just amazed at all of the freely available fantastic resources there are at NLM and via medlineplus.gov. And there's just so much out there to help everyone. And thank you for your presentation today.